If you've been told you have fatty liver or non-alcoholic fatty liver disease, the good news is it's fully reversible. And in this video, I'll go over the exact steps you need to take to not only reverse it, but to do it quickly and start seeing changes in weeks. I will also go over actionable advice on the foods you need to eat and the foods you need to stay away from to fix your liver. And at the end of the video, I will talk to you about other steps you can take to improve your liver health, and we'll also go over the best supplements you can take to help your liver recover and go back to normal. Hi, I'm Dr. Leonid Kim, and on this channel, I discuss the most up-to-date and evidence-based information on the topics of weight loss, metabolic health, and longevity. Let's get into it. Now, to better understand how to reverse fatty liver, we first have to identify what causes it in the first place. And it's pretty simple. Fatty liver is caused, for the most part, by overconsumption of sugars, and specifically fructose and sucrose, with sucrose being just table sugar that breaks down into fructose and glucose. The consumption of both fructose and sugar sets off a whole cascade of changes in our bodies that leads to not only fatty liver, but also to other conditions like diabetes, heart disease, dementia, and even many cancers. This isn't an exaggeration. The research is absolutely clear on this. When we consume excess fructose, our liver becomes the primary organ that has to process it. And unlike glucose, which can be used by every cell in our body for energy, fructose can only be metabolized by the liver. This puts an enormous burden on this vital organ. Think of your liver as a processing plant. When you send it small amounts of fructose from whole fruits and vegetables, it can handle that workload beautifully. But when you flood it with massive amounts of concentrated fructose from processed foods and sugary drinks, day after day, year after year, it becomes overwhelmed. The liver starts converting that excess fructose directly into fat, and that fat gets deposited right there in the liver cells themselves. Over time, this accumulation of fat causes inflammation, cellular damage, and eventually can progress to more serious liver disease. Now, what makes fructose unique is it doesn't stimulate leptin, and leptin is a hormone that is released in our bodies after a meal that signals satiety or fullness to our brains. So consuming fructose doesn't generate a normal response in our brain that tells us that we're full. It essentially bypasses our natural appetite control system. This is why you can drink a large soda or fruit juice and still feel hungry an hour later. Your body didn't register those calories the way it would if you had eaten a proper meal. So it makes it very easy to overeat. If that wasn't bad enough, continued consumption of fructose drives the development of leptin resistance, which results in persistent hunger and impaired satiety, even with other foods, not just fructose. You become trapped in a cycle where you're always hungry, always craving more, and your body's natural signals have been disrupted. This is one of the primary mechanisms by which the modern diet has created an epidemic of obesity and metabolic disease. A study published in the American Journal of Clinical Nutrition found in just 7 days of a high fructose diet increased lipid deposition in the liver and decreased liver insulin sensitivity. 7 days. That's all it took to see measurable damage. Now imagine what happens after months or years of this dietary pattern. The good news is that if the damage can happen quickly, the reversal can also happen quickly once we change our eating habits. Now, how do we avoid fructose? Well, fructose is a simple sugar that's usually found in honey, fruits, and root vegetables, and humans have been consuming those for hundreds of thousands of years. But it did not pose a health risk until we started eating manufactured fructose and sugar in large quantities. Our ancestors ate fruit seasonally, in limited amounts, always with the fiber intact, and never in the concentrated forms we have today. Now, most fruits and vegetables contain fructose. However, our intestines can inactivate about 4 to 5 grams of fructose, which is the amount we usually get from vegetables. This is an important point. Our bodies are designed to handle small amounts of fructose from whole food sources. We get a little bit more fructose from fruits. However, fruits like vegetables are also consumed with a lot of fiber, which slows down the absorption of the excess fructose. In addition to that, many fruits are also rich in vitamin C, which blocks some of the effects of fructose and really negates any of the adverse effects of fructose that we get from fruit. Fruits also contain beneficial compounds like antioxidants, polyphenols, and other phytonutrients that protect our liver and support overall health. So when someone tells you to avoid all fruit because of the sugar, that's throwing the baby out with the bathwater. Whole fruits eaten in moderation are part of a healthy diet and will not cause fatty liver disease. So that brings us to the first food group that we need to avoid to reverse your fatty liver, and that is sugary drinks. Now, we all know about the dangers of sodas and soft drinks, but the sneaky drinks that contain a lot of sugars are juices, which are often promoted as healthy and frequently given to kids. If you drink orange juice, apple juice, tomato, cranberry, or any type of juice, please look at the ingredient label and see how many grams of sugars you get just from one serving. Do not be fooled by statements like it contains natural sugars or it has 0 grams of added sugars. It may be natural, but it's still highly concentrated and it's consumed without the fiber you would normally get if you're eating a whole fruit. And it's a lot easier to overconsume sugars if we're getting it in liquid form as opposed to eating a fruit itself. When you eat an orange, you're getting 1 orange worth of sugar along with all the fiber, and it takes time to chew and eat. When you drink a glass of orange juice, you're getting the sugar from 4 to 6 oranges with no fiber consumed in just a few seconds. Your liver simply cannot handle that kind of sugar load in such a concentrated form. Other drinks that are notorious for just being loaded with sugars are sports drinks and energy drinks. These are marketed to athletes and active people as healthy performance enhancers, but they're essentially just sugar water with some electrolytes and caffeine added. Unless you're running a marathon or engaged in intense physical activity for over an hour, you don't need these drinks, and they're doing far more harm than good. Now, the American Heart Association recommends eating less than 24 to 36 grams of sugars per day. But if you suffer from fatty liver disease, I would abstain from all drinks that contain sugars. This means water, unsweetened tea, black coffee, and sparkling water should be your beverages of choice. It might seem restrictive at first, but your liver will thank you, and within weeks you'll notice you don't even crave those sweet drinks anymore. Along the same lines, I would also avoid eating dried fruit like dates or raisins or prunes. Yes, they're natural and do not contain added sugars, but those natural sugars are very concentrated and do not have the volume of the original fruit, which makes it much easier to overwhelm our GI tract and later our liver with fructose and sugars. To support that, a study published in JAMA in 2019 noted that just 8 weeks of restricting sugars in adolescent boys to less than 3% of daily calories has shown significant improvement in hepatic steatosis. 8 weeks. That's 2 months to see real measurable changes in liver fat. This should give you tremendous hope that your condition is not permanent and that you have the power to change it. Another way to fix your fatty liver is to eat more protein, and it's especially important to eat more protein for breakfast or whatever your first meal of the day happens to be. A recent study published in Obesity looked at over 9,000 Australians and found that getting enough protein, especially for the first meal of the day, had profound effects on what people ate later in the day. And eating higher levels of protein for breakfast translated to consuming less food over the course of the rest of the day. But people that had a low protein breakfast were found to eat more energy-dense processed foods and foods that were high in sugars. This is a game changer for most people. Starting your day with adequate protein sets up your blood sugar control, your appetite regulation, and your food choices for the entire day. So if you find yourself constantly craving those sugary or processed foods, foods that will make your fatty liver worse, try to up your protein intake, especially for breakfast, and aim to get at least 25 to 35 grams of protein per meal if you're getting 3 meals a day. What does 25 to 35 grams of protein look like? That's about 3 to 4 eggs or a cup of Greek yogurt or a palm-sized portion of meat or fish. It's not an enormous amount, but it's more than the typical toast and jam or cereal breakfast that most people eat. And the difference it makes in your hunger levels, energy, and cravings throughout the day is remarkable. Getting enough protein will help you eat less sugar and will help you lose weight. And weight loss has been shown to be one of the most effective ways to improve your fatty liver. In fact, just 5% of total body weight loss can decrease hepatic steatosis, and losing 7% of total body weight can lead to complete resolution of non-alcoholic steatohepatitis, or NASH, which is a more severe form of fatty liver. Let me emphasize this because it's so important. If you weigh 200 pounds, losing just 10 pounds can significantly reduce the fat in your liver. Losing 14 pounds can potentially eliminate it completely. These are achievable goals for most people, and the health benefits extend far beyond just your liver. Now, as you increase your protein intake, you have to be careful about what kind of fats you're getting in the process. Animal meats and dairy products are wonderful sources of protein. However, we do have to watch your intake of saturated fats, and those are usually found in red meat, processed meats, butter, ice cream, as well as many fried foods. Now, eating red meat is a controversial topic, and I happen to follow the camp of it's okay to consume red meat in moderation, but that's a whole other conversation for another day. What we know for certain is that the type and amount of fat we consume has a direct impact on liver health. A study published in Diabetes and Metabolism showed that while overfeeding with either saturated fats or fructose both increased liver fat, the group that was overfed with saturated fats increased liver fat to a much greater degree than the group that was overfed with fructose. This was a surprising finding because we often focus so heavily on sugar and fructose, but saturated fat in excess can be just as damaging, if not more so, to the liver. There are at least 4 human intervention studies that have confirmed the harmful effects of saturated fat on hepatic steatosis. But the one I want to highlight is a double-blind, randomized, controlled trial in which lean individuals were overfed with muffins high in either saturated fatty acids, in this case palm oil, or polyunsaturated fatty acids. This study used sunflower oil. And what they found was that just 7 weeks of overfeeding resulted in a marked increase in liver fat in the saturated fat group, whereas the polyunsaturated group caused a nearly 3-fold larger increase in lean tissue or fat-free mass without an effect on the liver. So the polyunsaturated fats actually helped build muscle, while the saturated fats were deposited in the liver. This is a crucial distinction. So it's important to not overeat saturated fats, and I emphasize not overeating, as it's okay to eat saturated fats, but in moderation. Eating more than about 5% of our calories from saturated fats is when we start getting into trouble. For most people, that's around 10 to 15 grams of saturated fat per day. So what that would look like is eating less fats that come from processed meats, or eating less store or restaurant-bought fried foods or pastries, as well as being careful with ice cream or cheeses. At the same time, we need to eat more of the good fats or poly or monounsaturated fats that come from fish, nuts, and avocados. And when it comes to oils, using olive oil is preferred to using saturated fats like coconut or palm oil. The type of fat we eat is especially important for those that are on very low carbohydrate or ketogenic diets, where a lot of the energy has to come from fats. Now, keto is a very, very effective way to lose weight and improve metabolic health, and it's very safe as long as the majority of the fat content comes from polyunsaturated or monounsaturated fats, as opposed to saturated fats. Many people have been successful using ketogenic diets to reverse fatty liver. However, for just as many people, that degree of severe carbohydrate restriction is just not sustainable long term, and that's perfectly fine. But the good news is that cutting out carbs is not a requirement for fatty liver reversal, and it's the quality and the type of carbohydrates that we consume that play a larger role in the treatment of fatty liver. Eating carbs that have a low glycemic index, meaning they do not cause wild swings in your blood sugar, are much better for your liver health than carbs that are high on the glycemic index. The glycemic index is a measure of how quickly a food raises your blood sugar after you eat it. Foods with a high glycemic index spike your blood sugar rapidly, which triggers a large insulin release, which in turn promotes fat storage in the liver. So while lowering our carbohydrates is generally a good idea for most people, I wouldn't worry as much about consuming lower glycemic index carbohydrates that come from legumes, dairy, vegetables, or fruits. These foods provide important nutrients, fiber, and sustained energy without the metabolic disruption of refined carbohydrates. And I would stay away from high glycemic index carbohydrates like white bread, white rice, most breakfast cereals, and processed potatoes like French fries or chips. These foods are essentially converted to sugar the moment they hit your digestive system, and they contribute to the same problems as eating pure sugar. To wrap this up, other things that are highly beneficial in reversing fatty liver disease is abstaining from alcohol. This should go without saying, but even moderate alcohol consumption can worsen fatty liver disease. Your liver has to process every drop of alcohol you drink, and when it's already struggling with excess fat, adding alcohol is like pouring gasoline on a fire. In addition to that, getting at least 150 minutes of moderate intensity activity per week and making sure to include resistance training or muscle building exercises at least 2 days a week would also help to restore your liver to good health. Exercise is one of the most powerful interventions we have for fatty liver disease. When you exercise, especially with resistance training, you build muscle tissue. Muscle is metabolically active and acts like a glucose disposal system, pulling sugar out of your bloodstream and using it for energy instead of letting it get converted to fat in your liver. Even just walking for 30 minutes a day, 5 days a week, can make a significant difference. If you do all of the things I mentioned in the video, you will see changes in your liver biomarkers in a matter of weeks, as seen in the studies we discussed earlier, and you will eventually fully reverse your fatty liver. It is important to do those as soon as possible before your liver turns into a more severe form of fatty liver like NASH or steatohepatitis, and eventually to fibrosis and even cirrhosis, at which point a liver transplant is our only option. This progression is preventable. You have the power to stop it in its tracks and reverse the damage that's already been done. But you have to take action now. The longer you wait, the harder it becomes. Now, if you'd like to enhance your recovery, you can also try adding supplements to the food changes we discussed. Now, to be clear, you do not need any supplements to fix your fatty liver as long as you eat the right things and you use real whole foods as your medicine. Food should always be your foundation. Supplements are just that, supplemental to a good diet, not a replacement for it. However, there are supplements that actually show some promise and could be useful in expediting recovery. First, therapy with vitamin E at 800 international units a day was actually associated with a significantly higher rate of improvement of steatohepatitis compared to placebo. Vitamin E is a powerful antioxidant that can help reduce inflammation and oxidative stress in the liver. I would, however, discuss vitamin E supplementation with your doctor first, as high doses of vitamin E, high meaning greater than 400 international units per day, have been inconsistently associated with an increase in all-cause mortality as well as an increase in the rate of prostate cancer. So the recommendation to supplement vitamin E is usually reserved for patients with a more advanced fatty liver disease. This is not something you should just start taking on your own without medical supervision. Second, I would also consider taking omega-3 fatty acids. A meta-analysis published in Clinical Nutrition in 2018 showed that supplementation with omega-3s, especially fish oils like DHA, was associated with an improvement in liver markers like ALT and AST, as well as with a reduction of liver fat. Omega-3s are anti-inflammatory, they improve insulin sensitivity, and they help reduce triglycerides, all of which benefit liver health. A good quality fish oil supplement providing around 1,000 to 2,000 milligrams of combined EPA and DHA daily is a reasonable approach for most people. Lastly, choline has been gaining in popularity as a treatment for fatty liver, and a recent case control study showed that people that consume high intake of choline and betaine had an associated 81% reduction in hepatic steatosis. That's a dramatic finding. Choline is essential for the liver to export fat. Without adequate choline, fat gets trapped in liver cells. However, we still need more conclusive research on if the supplementation with choline is actually beneficial for most people and not just those that are choline deficient, and at what dose do we actually get any kind of therapeutic benefit. Until we get more data, I would make sure you get enough choline from your food, which means eating plenty of eggs with egg yolk in them, lean meats, dairy, as well as getting enough seafood, which also happens to be very rich in omega-3 fatty acids. And if you don't eat meat, then I would focus on getting your choline from yogurt, sunflower seeds, and cruciferous vegetables like broccoli, cauliflower, or cabbage. These plant sources provide decent amounts of choline, though not as much as animal sources. Now, this is not a full list of supplements that are commonly used to treat fatty liver, but I will make a separate video on that down the road, as it does deserve quite a bit more attention. Other supplements like milk thistle, berberine, and NAC show promise in research, but I want to cover those thoroughly in their own dedicated discussion. I hope this video was helpful, and I will see you in the next one. Remember, fatty liver disease is not a life sentence. It's a wake-up call. Your body is telling you that something needs to change, and the beautiful thing is that your liver is one of the most resilient organs in your body. It has an incredible capacity to heal and regenerate when you give it what it needs and remove what's harming it. Start today, cut out the sugary drinks, increase your protein, choose the right fats, move your body, and be patient with yourself. Healing takes time, but it happens faster than you might think when you're consistent with these principles. Your liver and your entire body will thank you.